Good morning, and welcome to Mahala Monday. Absolutely fantastic to have you with us. It is the 10th of October, that's how it works.
That's right.
In today, 10th. Rhoda is here. Hello.
Good morning, welcome everybody. Morning, Dougal. How was the weekend?
Lekker.
Looked like it was lekker, I can see.
Good weekend, it certainly was.
I'm glad.
Yeah.
Same.
And today is a good show. It is a really good show, very important one as well.
Definitely. And it's one of those things that, a lot of people don't discuss, they don't talk about. But you know what? I'm always saying it's very important that we need to know what's happening with our bodies, what's happening with our friends out there.
It's funny you should say that people don't talk about it. We're going to talk about it. Now, first things first, it's an interactive show. Now, we look really forward to your contributions, your comments and questions today. Now, as you know, we told you earlier in the week, the past couple of days, you would have seen our ad, that today we're talking about mental health. And the reason is that because today is World Mental Health Awareness Day. That is what's today. Now, sadly, we had a guest, but unfortunately, due to prior commitments, something came up and our guest couldn't be with us. So we will revisit that and, of course, get an expert on for you. So apologies about that. So between Rhoda and I, we've done some research and we're going to be talking about it and just sort of get a general discussion. And I think it has turned out well that way as well, Rhoda, because it's really coming from a layman perspective. I mean, you and I are no experts on this.
Exactly, we're no experts. But you know what? We could actually just give from our point of view, and I think a lot of our public out there as well, because we kind of represent them. So, and not from a professional way, but just our personal experiences and obviously just what's happening out there in the world right now. So, definitely.
And for the point of the discussion, Rhoda is more expert here than what I am. But more importantly, we'll really look forward to your contributions as well and your questions. So today it is World Health Mental Awareness Day, which is significant because the landscape has changed in terms of health. And of course, our discussion will be, I suppose, primarily focused here on the South African context.
I would say the South African context, and where we're finding ourselves as South Africans, and I think especially, Dougal, after COVID, and I mean, we've always, during our show, during COVID, we always discussed and spoke about what's happening within the time during COVID. You know what, it's always kind of having to figure out where are we at right now, after what we've experienced as a country, as a nation, and prior to even before COVID, what we had experienced prior to that, So obviously we've gone through a stage, we as the public and the people out there has gone through some stages that, I mean, future generations probably won't be able to talk about or discuss,
Yeah. So this is what it's about. This is our topic for the day, of course, which is a very important topic. Now, let's just move from this sort of premises. We all agree on this, that health comes first, regardless of it. But you know what, and we've got some reports here for you. Yeah. We've taken some things here from the internet as well. So we got something from the Sage journals. Google is our friend and has provided us with some other stats. But also when you look at it in terms of just around 10 people, at least 60-70% of them have experienced some sort of mental health awareness or issue. But it is more profound like that, because you don't really think, because you mentioned COVID now, and I'm just realizing, like, I mean, this is all sorts of things. We're not even talking about patients or people who need medical intervention. We're just talking about basics, because depression.
Exactly.
Do you know what I mean? And let's be honest, there's nothing wrong with it, because it's a human emotion.
It's a human emotion.
It is. It's plain that everybody's been depressed at some point.
Exactly. Somehow in your life. And you know what? People look down on it. But you know what? It's a human. Like you say, you're human after all. I mean, we all get to a point where something's going to depress us, or we don't even understand what it is, especially amongst youth, where they're experiencing some feelings and some emotions for the first time, and they don't know how to actually put that into context and how do they express themselves. And I'm not a professional. We're not professionals, and I think more on what I'm experiencing now is our new generation, that social media, how they're spending time on their phones, and not like we back in the day played games, and some people my age will probably know about Kenichi and playing outside.
That's way above my age.
That's what I'm saying. That's where we interacted. We were with each other. There was no cell phones. What are we doing now? Everybody sits on their cell phone.
You know what?
So-
So soft skills you don't have.
Exactly.
But that is another topic. But I
That's
mean
another
something
topic.
something like depression. I mean you and we're not talking about clinical or when it has to be diagnosed. But all I'm saying is that there's not a big gap between what you could experience. Like, I mean, you wake up early on a Monday morning, you've got to navigate traffic or do whatever it is because your work week starts. You could say you're a little bit, you know, you're feeling a little bit down
Wow.
because the excitement is not there in terms of the weekend, what it is. And that is completely natural. And I'm not trying to make fun of this or make light of this in any way. But the point is that I'm trying to make is that when it comes to mental health and the mental awareness and our mental states, that it is easy to go from there until we really need help. And then when you put all of us as individuals and really the eclectic mix of what we are, and you put it in a South African context, it is very easy to see that there is a case to be made for greater awareness because we're living in a country where unemployment is quite high.
Very
We live
high.
in a country that is still feeling the after effects of COVID and lockdowns and the financial impacts thereof.
Yeah.
We live in a country where a crime plays an important part. And we also refer, you know, and gender-based violence is rife. So
That's real.
there's a lot of traumatic sort of things and that delves into a personal life. And then, you know, when it just comes to economic situations, and then the fact that you constantly maybe on a tablet or some sort of mobile device, all of these contribute to a different mental well-being, does it not?
Totally different mental well-being. And I'm just coming back to the depression and about the youth. What I was trying to say is that kids are not talking about the emotions, they're not expressing the emotions, and everything is being held in. And if you look at basically how do they express themselves, and this is where the depression comes in, how do they talk about it? And I mean, the suicide rate amongst our youth has really gone up. It's really gone up. And you know what? I actually had a discussion with somebody and they were talking about the fact that one of the family members was stressed out and they ended up at hospital because their high blood, automatically the blood pressure went up.
Yeah.
So because of the stress, depression, there's so much of this happening that automatically it affects your health to go. And you know what? This is where our hospital is letting a lot of our people down on. And I mean, I'm just going to be reading something quickly. That's one of, like we said, we did some research where in South Africa, and this is data presented by South Africa, College of Applied Psychologists, Psychology in 2018 suggested that 1 in 6 South Africans suffer from anxiety, depression, or a substance use disorder. 40% of South Africans living with HIV has a comorbid mental disorder. 41% of pregnant women are depressed. About 60% of South Africans could be suffering from post-traumatic stress. These figures include motor vehicle accidents and crime, while only 27% of South Africans with severe mental disorder receive treatment. I mean, the fact that only 20% of them living severe mental disorder receive treatment is indication of how mental illness has been neglected by the health system. You know, I mean...
And there's a small percentage of budget that goes to the mental health system, isn't it?
Exactly. As far as I read here, only allocate 5% of the national health budget. So 5%, I mean, that is so small at the end of the day, so minute. And if you really look at it, just listening to one of the people I spoke to, that the parent or person ended up at hospital because of stress related. They were unemployed. You know, they found themselves in a situation where they were anxious, they're depressed. You know what I'm saying? So if we actually look at the problem, and this is maybe where we need to then focus more, government need to focus more on the preventative cures. No use, I get sick and now you want to see to the treatment. Look at why I got sick. What was the reasons?
But now, having said that, Rhoda, listening to you, let me put it to you this way. Is it a case where people actually, do you know what I mean? If you've got a knee problem or you're coughing or your tummy is not feeling well, you know what to do. You go to the GP straight away.
Yeah.
When you're feeling a little down and your emotions is running wild and you can't really focus or whatever, you don't really go anywhere, do you? You don't tell anybody
you don't
even.
tell. Exactly.
Now,
exactly.
is that a societal thing? Is that something that we should be talking to our children to? Is that something that as friends we should be discussing? Because let's be honest, friends are also ill-equipped to say, what are you going to say?
Exactly.
You're going to
The
say, oh
issue-
no, go get yourself checked out. And who really does?
Exactly. And you know what the big problem is today, Dougal? A lot of people actually don't listen. They're more wanting to give advice. Sometimes somebody don't want your advice as far as I'm concerned. This is just my feeling. They just need an ear. They just need you to listen to them. Without telling them, go take a headache tablet. I've got a headache, go take a... No, I don't want a solution. This is too, but I want you to listen to me. And I think this is where a lot goes wrong. People are so involved in their own worlds and running around and they're in their own stress, their own depression, that sometimes I think if you actually just chat to somebody else, you might find out they're in the same boat as you, and that you could actually kind of relate and actually go through this together without even realizing that that person is actually just listening to you and helping you get through this. And I'm just coming back to depression. I mean, let's not kind of put this also and sweep it under the mat. Depression is a real thing. That
It is.
I mean that
Leads to other stuff.
it leads to other stuff, and we must never kind of look at somebody and say, oh, just take a tablet or go see a psychologist or go. Sometimes they actually tend to do this, but here the depression is so deep that they actually push themselves to really, they cannot see the, like, you know, we always say, look at the light at the end of the tunnel. But for some of these people that's suffering from depression, they don't see that light. It's just a different psychological space they find themselves in.
And I agree with you, because assume you are being treated for depression, whatever the case is.
Exactly.
And let's say it's because you're a victim of crime.
Exactly.
You live here. You live in Mzansi. It's a different situation.
Totally different.
If it's gender-based violence, you might not have moved out of your circumstances.
Exactly.
You might still be with that partner. That person might still be within your circle.
Exactly.
Although you're receiving treatment, you haven't changed your milieu. So you haven't, your habitat hasn't changed. You haven't moved from north to south. Like I'm literally saying, putting distance, geographical distance between you. You haven't done that. So you're treating something, but you're still facing the cause basically every day.
Every day,
isn't it?
you're still in that. And you know what, Dougal? A lot of people live in their houses, they live into their own little worlds, and they tend to forget that even if you're in your comfort zone, the next person might not be. Your colleague at the end of the day might not be in it, so might be living in that environment. And you know what the sad part about that is? The fact that this gets passed on from generation to generation. Because the reality of a child or person that comes from an abused background is the fact that that was life for them.
Yeah.
So they don't
Do you know
know
what?
anything different if they haven't been exposed to anything
Exactly.
different.
And I get angry at this because some people just brush it off. I get angry. I get angry at elders within my own circle. And I'm
Exactly.
talking family and friends. The lexicality, and when I say, you know, and I'm just the words that are being used.
Oh, yeah.
When I grew up, where I bumped my toe or knee or something,
Yeah.
and somebody used, and always I was told, no, cowboys don't cry. I'm not a cowboy.
Exactly.
So it is annoying to do that. And
Exactly.
I can say now I'm not a cowboy. I understood what it meant. Like, no, you got to man up and all of this. But you don't have to man up to everything.
You don't
Do
have
you know what I
to.
mean?
Exactly.
The strongest people are people who really understand their own emotions, because that allows them to act in certain ways
Certain
and
ways.
to act right within the various circumstances that they find themselves in. And that is a different argument. But there's a lot we want to talk about, because I've just realized, because one of the stats that I got, and I see Hubert has put up a comment, and Hubert, I want to get your opinion on this
Oh,
as
there we
well.
go.
Whoever is
Oh.
watching you, Hubert is also saying some stuff. We're going to get to that right now. Send your comments through, because we're talking mental, because it is today World Mental Health Awareness Day, of course, throughout every place. Now, South Africa is one of the lowest mental health scores in the world. Really? Now, let's be honest. This is now data that we've taken, we found on various websites that we have found. Really? South Africa is one of the lowest mental health scores in the world.
In the world.
And I'm questioning this. Is it true? Is it the fact that we live in a society where we pamper along, where we go, oh, cowboys don't cry, no, don't be a, you know what I mean, eat it up. Is that the one reason? Considering unemployment, that's depressing in its own. When you read the figures, I mean, it causes emotions in you. When you load shedding, when you experience it, you telling me that keeps you positive? When you look at public services, policing, housing, schooling, healthcare, that keeps you happy? But still we have the lowest. The impact of COVID, unemployment. Does that still keep you happy? I do not believe that we have one of the lowest, but let's assume we do.
So
Then it speaks to the resilience of the people.
I was actually going to tell you, Dougal. So, and I'm probably going to contradict you.
But let me say this.
Yeah, go for it.
I don't think this is completely true. I think it indicates and highlights the alternative argument that we don't have access to these services, and the fact that it's not recorded and reported. And secondly, I think it is the fact that this is not something we openly discuss. We don't openly, because it's a bit taboo. Because if this happened to happen in my household, nobody will know.
You know what it comes down to, and this is my personal opinion, and I mean, you've indicated now where that is concerned, why we have the lowest. And me personally as well, I think for the fact if they did their stats properly, and we actually did it correctly within South Africa, and Africa and as a whole, not just in South Africa, we're talking about the world, obviously, so we're talking about the African continent, that if you really had to do the stats properly, you would probably find it would be much higher and it wouldn't be the lowest, as far as I'm concerned. And then I think our people in Africa, the resilience to, I mean, look at Ebola at the end of the day. People already prior to that washed their hands, wore their gloves, because of the fact that we were exposed to these type of pandemics, am I correct? And I think in that way, our resilience was a bit more, and I mean, a good example, I know of somebody that one of the supposed to be first world countries, because they look at us as a third world country, and they weren't basically giving their kids vaccinations because that's a third world thing, where we as in Africa is giving our kids vaccinations. So somehow in its own little way, I personally think that we kind of obviously pushed ourselves a bit on another level on having to say like, you know what, we've been hit by COVID, we kind of having to know more or less how to deal with it, where the rest of the countries were living in this bubble and the rest of the world was living in this bubble, that we, not third world, we are on top of the world, we've got our things together. And once this hit the rest of the world, so I expected South Africa, or at least Africa, to actually get the worst hit. And yet we were one of the countries that was kind of more prepared for this than the rest of the world.
You see, and the reason I'm saying that, look, it's a good thing if the reports indicate that our numbers are lower here in this country. It's a good thing.
We don't believe, probably.
But I'm taking it with a pinch of salt, because if I compare, and the populations are different. If I compare countries with a very similar makeup, the likes of Brazil, Venezuela, India, these sort of places, then that is quite high. And also, if you're looking at English-speaking countries, there seems to be a bit of where English is certainly a predominance. And obviously, the global landscape with English has changed in the last couple of years. But there seems to be a little bit of a difference as well. The other thing is, which is another stat that I'm looking at, and I have it here in front of me. You see, South Africans are now more distressed than in 2020. Now, given what has happened, COVID, the lockdown, about 4 million people estimated lost their jobs within the first lockdown. That is the estimation, 4 million. And that is already adding to a number that was sky high. I mean, we look at unemployment, the world is there, you kind of got to get to that level and look up, and then you only see us, and that's the back end. So there's Hubert, he says there are 3 types of lies: lies, damn lies, and stats. So he's not believing my stats either. But these are the things that, you know what, and I just think in terms of that, I mean, I've heard of people that were diagnosed bipolar, people that were depressed. And let's be honest, this is, we live in a different age.
Totally different.
You know what I mean? Your life is normally the sum total of your experiences. So if you had traumatic experiences, it will have an impact.
It will.
Regardless of what it is. Now we just, you've witnessed something. When you watch, there's a reason why children at 5 don't watch violent and horror movies and certain language things. There's a reason for this. Because can you imagine if you're exposed to that at 5 or 6 as an informative person, what kind of adult you're dealing with?
Exactly, exactly.
Can you imagine? So there's reasons that this happens, which means our emotional state changes constantly. It's a constantly, I mean, it is. I'm a very emotionally, very different man than what I was this morning, let alone last week, and a month ago. Was unrecognizable.
Exactly.
For myself. So, but I do think that it is a case where we need to have these conversations.
Well, you must.
Because we don't have the conversation. And I want to take you to this, because we all remember the tragic thing with the Life Esidimeni incident. Now, the South African government has been applauded, and sort of significantly so, for having certain policies in place for, and not because of what happened with Life at Esidimeni, but for sort of being proactive and saying, all right, we need to move forward here when it comes to mental health awareness, when it comes to the psychology of the person. We need to move a little bit forward there. But there is a bit of a disconnect between policy and implementation.
100%.
Not a bit of a disconnect. It's like a non-connect, like a load shedding.
Exactly.
and that is where I find. So I actually, when I saw this in one of these things, and I know we're going on a bit now, but when you look at what happened, and it was sad. I mean, so many people lost their lives. It is, but the basic stat is 50% of public hospitals offer mental health services in the country. That's 50% of public hospitals.
Sure.
Just half. That is all we're looking at. And with only 50% of them offering mental health services, they now, only the 50% have like a psychiatrist, and about 30% do not have a clinical psychologist. So when we look at Life Esidimeni, it sort of illustrates the neglect of mental health services within the country. And I mean, whatever happened there, we all saw the news reports. I mean, it was, you know, it's tragic.
It's tragic.
But it brings me back to the question, do we now take an active role when it comes to friends and family and say, guys, all right, you've gone through something, you've lost a family member, whatever it is, you finished your matric exam, you're stressed out about work, you want to get a promotion, you're stressed out about sitting in traffic. Do we now, as normal people, take an active role and say, all right, talk to me, what's going on? Remember, I've got no skills in helping you. Do we do that from going forward?
Me personally, Dougal, it's really a case of your friend in need is a friend indeed. And that's my wording at the end of the day, is that just have an ear, you know? And like I said many times, I don't think people want to be given the cure, they just want to be heard. And if the traffic was bad, you know what? Oh, I was so mad, I was so furious, and this is what we need to express. People are not expressing themselves. If you're mad, you're mad. And like you said, if you want to cry, cry. If you want to hit the table rather.
Rhoda, because it's difficult. Let's look at what is one of the most stress-causing things. And let's not look at like the hard things, like let's just look at financials.
Oh.
One of the most stressing things, right? Yes. I mean, when you don't have money, like you don't know how you're gonna make ends meet.
So true.
You know what I mean?
Exactly.
It's a physical stress. It's a stress beyond belief, and sometimes it drives you to do things you would never have done.
Never have done.
So we can accept that. Even the have-nots have got financial stress. The haves also have stress because the haves are being bombarded by the have-nots, and they also get a stress. And it's the same cause, because you have something somebody else don't have, lots of it. It's the same cause, but you're both sitting with stress from the same thing.
Same thing.
So it is you cannot say you are not touched by it. You cannot say it doesn't impact you. You cannot say. What I do think is we've got to be a bit more aware about it. We've got to be a bit more conscious about it, be a bit more open about it, and realize that anything is a trigger point.
Anything, Dougal, anything. And I'm just listening to you at the end of the day there's such a lot of stress out there, and especially just talking about finance now. And one of the things a lot of people don't understand, and I read an article once on this gentleman he was crying, he was sitting in his, at least a video, he was sitting in his car, he was crying, and he was talking about the fact that you know, why can't men discuss how they're feeling, the frustrations they have of having to be the husband? Because naturally, we are all born and kind of born with a man feeling that he needs to be the provider. He needs to make sure that everything is fine, everybody is secure, so safe. A woman naturally has, you know, the caregiver. Are you fine? You know, can I put a plaster on your leg? You know, being there emotionally. So I also want to say out there, for the men out there, like you were talking about that, you know, the cowboys mustn't cry. That's something I never raised my son basically to be either. It's like cry. I mean, I had a song for him. Whenever he was feeling down, I would play the song for him. Go on and cry, my son. So, you know, that's exactly, I feel, where we need to be. Allow them to feel that emotions, because when they get older, they're sitting with this pent-up frustration on not being emotionally saying, you know what, you can actually cry.
Pressure cooker.
The pressure cooker, basically creating a pressure cooker. So you know what? For me personally, we need to look at where we find ourselves. And people evolve, humans evolve, and people evolve at the end of the day. So we find ourselves in different circumstances. What our parents did back in the day, Dougal, you cannot do right now. Times are different. Social media, everything.
You can use the fundamentals, but it's adapted.
But it has to adapt.
It's changed.
It's changed. So we need to look at this, and we can't say, oh, this is how my father was, I'm also going to. We just need to look at the dynamics of where we find ourselves. And like you said, what do you do if a friend comes to you, or, you know, if somebody looks down? Do we turn and walk away, or do we actually say, are you okay? You know? So just by, are you okay? Even just a smile, if somebody, you know what I'm finding extremely irritating, Dougal, is when you go out in public, when you greet somebody, you smile with somebody, they look away.
Yeah, like you want something.
I'm saying? Like you want something. The decent thing is to say, hi, good day, and walk
too.
away and greet.
From now
smile.
on, do you know what? From now on, I'm actually going to highlight to these people that they are. Hubert says there is no normal life that is free of pain. And that, yeah.
That kind of sums it up. You're never going to be in a good world, that you're never going to have problems.
So, do we,
That's
from
life.
what, because this is now what we've done. Me and you have spoken now about mental health. Do we go out and say, okay, Rhoda and Dougal, from tomorrow, just be a little bit more aware, a little bit nicer to people? Just make a bit of a effort.
Just make a bit of
Do you know what I
effort.
mean? Understand your own emotions, understand your own limitations, understand the things that is within your realm. Accept those things. Do you know what I mean? And try and change the things for the better. And I know it's going to sound high and mighty, and I'm in no way anything like this. But whenever I do something, I'm always of the belief: is it fair to everybody else? Do you know what I mean? But it needs to be fair to me.
Exactly.
So, you know what I mean? So whatever I do, I try and, you know, make myself happy, obviously. And that's the first thing. But is it fair? Do you know what I mean? It shouldn't be coming at the expense of somebody else.
So true.
I think we should be more aware. I think we should be more enclosing and government with our emotions and all of that. And understand that this is, it's easier for somebody to have a mental health issue than it is for them to have an actual cold or a cough or sore throat. And I think that is it, because the factors that influence mental health now, in the 80s there were 4, is now 4 million.
So true.
And I see, I'm clever today.
Hey, very clever.
Yeah.
So people out there, youngsters out there, adults out there, you know what, there is help. There's a national helpline numbers. I think if our guys can just display that for us, you know, if there's any need that you need to speak to anybody and you're feeling depressed or you're feeling suicidal, the numbers is on our screen there. That's the national help numbers. So if you find yourself in any of those circumstances, pick up the phone and actually just make that call. Even find out in your community if there is somebody that you could speak to. They would probably refer you to the correct person. And you know what? There's nothing wrong with basically putting your hand out and asking for help. There's nothing wrong with it. So you know what?
And these numbers are important. These are
Very
as important as
Very
having
important.
your ambulance, fire brigade, and house doctor, GP on your wall, wherever you have it. These numbers are as important as that. But it is the second thing, apart from this, Rhoda. This is the kind of thing that we've got to talk about in our household. And make no mistake, learners are discussing this in school.
Oh, they definitely are.
They are discussing this in school. So you'll be super surprised how much your 8-year-old, 10 and 12-year-old actually knows as far as this is concerned. Let me tell you that right now. So they're definitely discussing it, and I think we should talk about it. And we should have an approach of being supportive and a bit more understanding when it comes to mental health issues. And today is World Mental Health Issue, and that is exactly day at least. And what you should be doing is definitely discuss this and just sort of have the conversation going. You'll be surprised how it changes perspectives. My perspective has changed.
Definitely.
On certain things. Yeah. Is that it, Rhoda?
That's it, Dougal. We can wrap this up.
My goodness, we spoke for half an hour.
Oh, wow. Oh, no.
Yeah.
I didn't see that one coming.
And I actually surprisingly didn't have so much to say. Hubert had a couple of comments there. He's got another one there that says, happiness depends on ourselves, but what worries you masters you. And I think that is
Sure.
That is true. Whatever, that is going to rule you. So don't let it. Don't let it. Don't let it. Thank you very much, Hubert. And thank you very much, everybody, for watching. Of course, please like and share this and hit the notification bell, ding dong, and then you know when our next episode is coming. And we're back next week.
That's right. We're back next week. So we'll see you then.
Cheers, everybody. Have a wonderful, wonderful day further. All the best for the week.